Hariom. I am Bhavya Jha of class 10C and today I am going to present a presentation on light-based therapies and medical application. Light and optical techniques have made profound impacts on modern medicine, with numerous lasers and optical devices being currently used in clinical practices to access health and treat diseases. Recent advances in biomedical optics have enabled increasing sophisticated technologies, in particular those that integrate photonics with nanotechnology, biomaterials, and genetic engineering. The modern use of light in medicine began in the 19th century, with rapid improvements in the understanding of both the physical nature of light and fundamental light matter interactions. A notable example of an early triumph in phototherapy is the ultraviolet UV induced treatment of lupus vulgaris, invented by physician Niels Vinsen, who in 1903 was awarded the Nobel Prize in physiology and medicine for this application. Since 1960, the development of lasers has opened new medical avenues. Today, numerous laser-based therapeutic and diagnostic devices are routinely used in the clinic. Role of light in medical treatment and therapies. The use of light has expanded into new and exciting practices including supportive cancer care and treatment of depression, oral mucositis, retinopathy of prematurity, and cardiac surgery complications. Light is also being used in the treatment of neurological diseases such as Parkinson's disease, traumatic brain injury, and multiple sclerosis. Following are some light-based therapies. Photodynamic therapy. It uses a drug that is activated by light, called a photosensitizer or photosensitizing agent, to kill cancer cells. The light can come from a laser or other source such as LEDs. Photodynamic therapy is also called PTD. It is most often used as a local treatment, which means it treats a specific part of the body. When cells that have absorbed photosensitizers are exposed to a specific wavelength of light, the photosynthesizer produces a form of oxygen called an oxygen radical that kills them. Photodynamic therapy may also damage blood vessels in the tumor, which prevents it from receiving the blood it needs to keep growing, and it may trigger the immune system to attack tumor cells, even in other areas of the body. Phototherapy for mood and sleep disorders. Bright light therapy is a type of phototherapy used to treat mood and sleep disorders. It involves using a light box, a specially designed box that emits a steady light that mimics sunlight. Bright light therapy works by stimulating cells in the retina, which connects to the hypothalamus, the brain region that controls our circadian rhythms. Laser surgery. Laser surgery is a type of surgery that uses special light beams instead of instruments for surgical procedures. Laser stands for light amplification by the stimulated emission of radiation. Lasers were first developed in 1960. Newer laser modifications continue to have a large impact on medical and surgical practices. A large part of their impact has been seen in the treatments of various skin lesions and diseases. There are many indications for the use of lasers in surgery. The following are some of the more common indications: to remove tumors, to help prevent blood loss by sealing small blood vessels, to seal lymph vessels to help decrease swelling and decrease the spread of tumor cells, to treat some skin conditions, including to remove or improve warts, moles, tattoos, birthmarks, scars, and wrinkles. Optical imaging. It uses light and special properties of photons to obtain detailed images of organs, tissues, cells, and even molecules. The techniques offer minimally or non-invasive methods for looking inside the body. It reduces patient exposure to harmful radiations by using non-ionizing radiation, which includes visible ultraviolet and infrared light. Because it is much safer than techniques that require ionizing radiations like X-rays, optical imaging can be used for repeated procedures to monitor the progression of diseases or the result of the treatment. Advantages of light-based therapy. Phototherapy kills cancer cells by generating reactive oxygen species and local hypothermia under light. It has attracted extensive interest in the clinical treatment of tumors because of many advantages such as non-invasiveness, high patient compliance, and low toxicity and side effects. Babies who are born with jaundice have too much bilirubin in their bodies, which makes their skin and eyes look yellow. Blue UV light therapy helps babies get rid of bilirubin so it doesn't become harmful to them. Thank you and have a nice day.